kidney problem in diabetics, and also excess blood sugar, which causes excess loss of water from the body, can cause imbalance in sodium and water metabolism, resulting in hypertension. Hence, it is important to treat both hypertension and diabetes aggressively. So, if a person has diabetes along with hypertension, once a year the person has to do a complete body checkup, which should include a complete blood count, sugars, lipid profile, a renal profile, liver profile, including uric acid and urine routine, and a sonography of the abdomen, an X-ray of the chest, an electrocardiogram, that is ECG, echocardiogram, that is sonography of the heart, and a stress test. All these tests helps us to find out whether there is any end organ damages or any impending complication which we can detect and therefore treat. And it also tells us the value of the blood pressure so as to adjust the medications accordingly, and also tells us the value of blood sugar so that adequate diabetic treatment can be given. So let us consider the treatment of diabetes with hypertension. In that, the lifestyle modification methods are more or less similar for both. So if in hypertension we need to control the diet, so also in diabetic. So together, a diabetic and a hypertensive has to have a low calorie, low fat and low sugar diet, but it should be a well balanced diet, and also a weight loss diet, especially if the body mass index is high. Also, both diabetic and hypertensive will benefit from a regular exercise schedule. I recommend that if possible, a daily exercise schedule of almost about an hour should be done by everybody, depending upon the other cofactors and premorbid conditions. 1 hour of walking or 1 hour of cycling or swimming or some such exercise is necessary. What I recommend is a low grade, low intensity but long duration exercise. If you do a high intensity exercise, then there is likely to be complication, because both diabetics and hypertensives will have some other problems like a knee problem, a cardiac issue, etc. And therefore, the best thing to do is a low intensity, long duration exercise. Exercise helps diabetics to reduce the blood sugar. It helps the diabetes indirectly to reduce the blood cholesterol. It helps the hypertensives by increasing the blood circulation and therefore decreases the blood pressure. It helps both diabetic and hypertensive by reducing the weight and therefore reducing the blood sugar as well as the blood pressure. And so exercise, regular exercise forms a very important part in the management of diabetic with hypertension. The medications which has to be decided by your doctor will include in diabetic oral drugs as well as insulin as needed, and in hypertensive will require oral antihypertensive drugs as dictated by your blood pressure and decided by your doctor. Weight loss is very important, as we discussed, as also a low calorie, low fat, low sugar but a well balanced diet. So if a diabetic controls his blood sugar properly, then it automatically leads to some control of the blood pressure as well. At the same time, a good control of hypertension in a diabetic reduces the probability of the person landing up with complication. So good diabetic control prevents the progression of complications in a hypertensive. It reduces and delays the end organ damages, and it also reduces the mortality and morbidity. Thank you.